Hello and welcome to the TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about diabetes. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode is for people with diabetes, their families and carers, health and social care staff, and anybody who has an interest in the health needs of people with diabetes. We will speak with experts from the HSE's Chronic Disease Management Hub here in TUH, who specialise in diabetes support and management, and our own experts in the Diabetes Day Centre at TUH University Hospital. This Let's Talk About Diabetes series has been brought to you by TUH in partnership with the Healthy Communities Development section of South Dublin County Partnership. My name is Valerie Twomey. I am a clinical neuropsychologist and head of psychology at TUH University Hospital. I also work directly with patients in the TUH Diabetes Day Centre. In this episode of Let's Talk About Diabetes, I'm delighted to welcome Fiona Fullam, clinical nurse specialist in the Chronic Disease Management Hub here in TUH, also in general practice, and clinical nurse specialist at TUH University Hospital Diabetes Day Centre. True integrated care, Fiona. And I'm delighted to also welcome Fiona Boyle, Senior Podiatrist from the Chronic Disease Management Hub here in TUH. Today we're talking about how people living with diabetes can mind their diabetes complications. A big welcome to you both. Hello and thank you for joining us.
Thanks, Valerie. It's great to be here today to talk to you about all things feet.
Thank you, Valerie, for inviting me here today to talk about diabetes. It's great to be here today.
I'm really looking forward to hearing more from you both. We're talking complications of diabetes today, which is quite a serious subject. I might just start with you, Fiona Fullam, if that's okay, from your nursing experience and your background. Can you tell our listeners what are the complications of diabetes?
So diabetes can lead to complications, and it is to do with high sugars, high blood glucose levels over time. So it can cause health problems. It can cause problems to your eyes, your kidneys and your feet, and can cause other health problems, heart attacks or strokes.
And some of those are quite serious that you're describing there, Fiona. Can you tell us a little bit more about them?
So with eye problems, which is known as retinopathy, some people may develop an eye disease called retinopathy, which can affect their eyesight. If retinopathy is picked up, usually from an eye screening test, it can be treated and sight loss can be prevented.
And you mentioned also other quite serious complications. Kidneys, I think you mentioned?
Yes. So kidney problems is known as nephropathy. So diabetes can cause damage to your kidneys over a long period of time if your sugars are running at a higher level. And this can make it harder to clear extra fluid and waste from your body. It's caused by high blood sugars, but in addition, high blood pressure can cause this as well. And this is known as nephropathy or kidney disease.
Okay. And those high blood sugars sounds like they're affecting lots of other parts of the body.
Yes.
You mentioned the feet, but I think you also mentioned quite serious complications like heart attack and stroke. Can you tell us a little bit more about that?
So again, it's to do with the blood supply around your body. So if your sugars are running high, it can cause issues with the blood flow to the heart, to the brain, and you're at higher risk of a heart attack or a stroke.
We are also joined today by Fiona Boyle, Senior Podiatrist from our Chronic Disease Management Hub here in TUH. Fiona, how can diabetes affect the feet?
So I suppose firstly, it's important to note that having diabetes doesn't mean that you will develop diabetic foot complications, but you are at much greater risk of developing foot problems and complications. Diabetic foot complications, they stem from the impact of diabetes and high blood sugar levels and the effect that that has on the arteries and the nerves in the body. So the high blood sugar levels can damage the arteries and reduce the blood flow and also damage the nerves in the feet, which can result in a loss of sensation or a lack of feeling in your feet. A loss of feeling can then put you at increased risk of an injury. So if you can't feel your feet, you're at higher risk of getting a cut, a blister, a wound, which then is at increased risk of infection, which, if not looked after in time, can result in, unfortunately, surgery in some cases and amputations.
So if I'm a person living with diabetes and I'm worried about my feet, what should I be looking out for?
Great question, Valerie. That's something that comes up on a daily basis in my practice. So it's important to keep an eye on your feet. Diabetes affects the feet in terms of circulation and sensation. So it's the worst case scenario that, you would develop an amputation. Well, firstly, an ulcer, which might lead to an amputation. But it's important to note that if you detect the problem in time, if you seek help and receive timely care, you have a much better chance of healing and a reduced risk of amputation, and the overall outcome is much better. But it is important to remember that there's things that you can do yourself. So as a patient, there are things that you can do to look after your feet yourself. So checking your feet every day, as simple as that. If you find it difficult to see your feet, if you can't reach your feet, you could use something simply like a mirror. Or if you have any trouble with your eyesight or any problems like that, you could always ask a family member to have a look at your feet. And I know family members can sometimes be a bit like, I don't want to have a look at your feet, but it is very important that you know what's going on. If you can't see, it's important that there is somebody keeping an eye on them. And then back to the basics of washing your feet, drying them well, applying a foot cream to prevent the buildup of dry and hard skin. And it's very important to make sure, a lot of people don't actually know this, it's very important not to put cream in between your toes because the cream can get stuck in there and it can break down the skin. So that's an area that we would see in our practice a lot, is patients developing ulcers from moisture in between their toes. So that's just a simple tip. Also, never go barefoot. So avoid walking barefoot. Always wear shoes and slippers, even in the house. That's important to prevent injury. You don't want to stand on something, a piece of Lego that might be on the floor, even a piece of glass. If you haven't got full feeling in your feet, you don't want something like that sticking into your foot for obvious reasons of the complications it can cause. Wear shoes that fit you well. So make sure that you're getting measured. A lot of patients coming into us might not have had their feet measured for quite a long time. They might always have been a 5 and they've never, in the last couple of years, might not have got their feet measured in a shoe shop. So that's something to be aware of. And also, it's important to go shopping for shoes at the end of the day, because if you suffer from any swelling or anything like that in your feet, the end of the day is when the shoes that you are trying on will fit you best on a day-to-day basis. And break in new shoes slowly. Break them in until they're comfortable. Check your feet regularly. If you have peripheral neuropathy, which is a loss of feeling in your feet, you might not know that you might not know that the shoe is rubbing and causing problems or isn't fitting you correctly. So it's important to keep an eye on them to check your feet. And then trim your toenails. So cut your toenails straight across and file the edges to prevent anything digging in at the side. And if you can't reach them, or if you have any problems with ingrown toenails or anything like that, don't attempt home surgery. So we don't recommend getting some implements yourself from a pharmacy and treating it. We would recommend that you attend a podiatrist. Don't try and remove any corns or calluses, and they can lead to further problems. Tissue breakdown. If you try and treat some of these things at home, the chemicals can be quite harsh and it needs to be in a controlled environment if you do have diabetes. Just again, keep active. Increasing your heart rate increases the blood flow to your feet. So it's important to stay active, to pump good healthy blood flow down as far as the feet. The feet are the furthest thing away from the heart. And get your feet checked. So at your annual GP visit, when you're getting your bloods done, your blood pressure, also ask the practitioner, either your practice nurse or your GP, whoever is doing the assessment, to have a look at your feet, just to make sure there are no problems. There's just some basic tips. It's important to note as well that if you do have any concerns about your feet, any numbness, tingling, pain, attend your GP for assessment. And if your GP has any concerns, they can always refer you to your local HSE community podiatry clinic for further assessment. If you do notice a cut, a blister, a wound, or anything like that in your foot, it's basic first aid in the first instance. So keep it clean, keep it covered. Any signs of infection, redness, pain, pus, anything like that, delayed healing, don't delay attending your GP for review. Or if you are already linked in with the HSE podiatrist, contact your podiatry team. and they will see you.
They are wonderful tips. Thank you so much, Fiona. Not just for people with living diabetes, but I think also in general, I know I'm definitely taking home a few tips. And in other episodes of this podcast, we've been talking about support for people living with diabetes and how important that diabetes team is. Fiona Fullam, I'm going to come back to you because education I know is key, and prevention. So how can I, as a person living with diabetes, how can I prevent these complications from developing?
So it is not inevitable that everybody will go on to develop complications of diabetes. You can really take action yourself and prevent or delay the complications or any side effects of diabetes. Really important. So we've a lot of structured education programs running in the community. They can be taken online or face-to-face, and they will cover every aspect of diabetes. There is podiatry, there is dietitians, there is nursing. So there's plenty of courses there. And, you know, as I said, you can do them face-to-face online if you're at work. And they are doing some courses in the evening.
And if I was to ask about those courses, do you have the name? Like, what should I be asking for?
Discover Diabetes.
Okay,
for type 1, you've got Daphne, which is running in the hospital. So Daphne is a course of structured education for patients with type 1 diabetes. And that can be done online as well. You've actually, through the Diabetes Federation, you've courses running online as well. And also there are online courses, short courses that you can access, which may take about an hour to learn more about diabetes.
Okay, so informing myself is one way.
Yes.
Other ways for preventing my complications. What should I be doing?
So what you should be doing is get to know about your diabetes. Really important to get to know your targets in terms of what your blood sugar levels should be. So the HbA1c is a test that is taken either by your GP or in the hospital. And this would give an average breakdown of what your blood sugars are over a 10-week period. And understanding your levels are very important. So always ask your doctor or nurse, what are the levels I should be achieving and how I'm getting on? Am I there? It's very important to take your medications as prescribed. So if you have any questions about your medications, always check with your nurse or with your doctor. So these medications will help control your blood sugars, but they will also give you added benefits. They will protect your heart and your kidneys. And as I said, it's really important to ask any questions if you don't understand why you're taking your medications. It's really important to eat a healthy diet, be active, and to maintain a healthy weight. And if you smoke, to stop smoking. It's also important that you have your blood pressure and your cholesterol checked. And it's important to understand what your target should be for your blood pressure, your cholesterol. So again, always ask your GP or your nurse about this.
And I suppose we've, been talking a lot today about how complications can affect the whole body. Mm-hmm. Given that we have Fiona Boyle joining us today, how can these complications with the feet in particular be prevented?
I suppose it goes back to the old saying of prevention is better than the cure. Firstly, having an understanding of how diabetes affects the feet can help you to avoid the complications, an awareness and understanding, and receiving education on diagnosis. So this is something within the HSE we have had huge emphasis on over the last couple of years, of educating patients at diagnosis instead of down the road when they have already encountered complications. So top tips for healthy feet. So the good news is that most foot problems can be prevented with good blood sugar control and also regular foot care.
And many of our listeners may never have met a podiatrist before. So where can they find the podiatrist?
We are located in all health centres around the country would have a podiatrist in most locations, but it's not just within the service within the HSE. It's also, there are private podiatrists as well with access. There is a scheme called the Chiropody Card Scheme, which everybody over the age of 65 who has a full medical card is entitled to apply for, which gives them routine podiatric care at a reduced cost. So that is a service that it's good to be aware of for anybody who does need that extra extra bit of help.
We've learned a lot today in this particular episode about complications themselves and about preventing them. But before we wrap up, Fiona, I'm going to come back over to you. Is there anything that you think anything else that our listeners would like to learn from you today? Any further points that you'd like to raise before we finish today?
Really important to attend all your appointments. And if you're unable to attend them, because people can be on holidays or have other things going on in their lives, to actually ring and let the appointment section know that you're unable to attend to get your appointment scheduled. And really important to talk to your family about it as well, that you get support from your family with your diabetes. And also your healthcare professionals. We're very happy to talk to people about their diabetes. So always ask if you've any worries, any concerns, if you don't think you're doing well with your diabetes, always talk to us about it.
And it's really wonderful to know that you actually go out from the Chronic Disease Management Hub here in Tallaght and the Diabetes Day Centre out into general practice. So you're meeting patients practically on their doorstep.
Yes.
So it is that easy
Yes.
to access the support, which I think is great. I'm going to come back to other Fiona with a similar question. You know, anything else that you'd like to say to the listeners today? You've given them some wonderful tips. Maybe anything we didn't get to discuss earlier.
My key message will be to check your feet and get your feet checked. Stop small problems becoming serious ones, as early detection is key.
Great. Thank you so much to both of our contributors today. I'm very delighted to have had Fiona Fullam, Clinical Nurse Specialist, and Fiona Boyle, Senior Podiatrist, with me. And thank you for listening. In our next podcast, we will be joined by Noelle O'Keefe, who will be talking about diabetes distress and how challenging it can be to live with diabetes. This Let's Talk About Diabetes series has been brought to you by Tallaght University Hospital in partnership with the Healthy Communities Development section of South Dublin County Partnership.